Infectious Diseases, Policy and Research at Boston University. Dr. Mosoka Fallah is the founder and chief executive officer of an NGO in Liberia in the United States called Refuge Place International. It addresses the issues of access to quality, affordable healthcare that impacts maternal and infant mortality among urban poor and rural dwellers in Liberia, and is about to open an office in Sierra Leone. He was awarded the USAID Liberia Health Worker and Development Person of the Year 2017 for his work with Refuge Place International. So he was the recent past Director General for the National Public Health Institute of Liberia that he co-founded. The National Public Health Institute of Liberia was developed as a consequence of the devastation of the 2014 to 2015 Ebola outbreak in Liberia. Dr. Fallah completed his PhD in immunology at the University of Kentucky, and that's how we have our connection with him when he was here in Lexington. So he did his MPH work at in global health and infectious disease epidemiology at the Harvard Chan School of Public Health. So for his work building community level trust in the Ebola response, Dr. Fallah was named a Time Magazine Persons of the Year in 2014. He was also the co-founder and Director General of the National Public Health Institute of Liberia, founded in response to the 2014-2015 Ebola outbreak in Liberia. In June 2019, he visited the DRC, Democratic Republic of Congo, as part of a team of local NGO and York University in Canada to evaluate and advise on the Ebola response. His past and current work takes him across the continent of Africa, where he closely works with ministries of health and national public health institutes on pandemic diseases or the COVID-19 vaccines.
Is my screen on? Can you see my screen?
Yes, sir.
All right. I thought to speak a little bit about the resilient health system in Liberia from Ebola to COVID-19 and conclude on the mental health situation in the country. To understand the mental health situation in Liberia is to look at two major events that happened in the country. One of those was the Civil War, the 14-year Civil War that started in 1990 and ended in 2014. It was a brutal civil war, ethnic cleansing, massacre, cannibalism. Our lives got disrupted. So as a result, it threw the country back. A whole generation got lost. I was one of those very lucky ones who had the opportunity to come to the US just as the war was coming to an end. In 2004, the American military had arrived, and around that time, I got a scholarship to come to the US. Went to Kent State University for a first master, and then came over to University of Kentucky. So as a result of the devastation, 14 years, an entire generation did not go to school. The trauma, which I'll show later, the drugs, the trauma, the murder, the killings. Being a young teen from high school, I remember incidents where I was walking and the bodies were all in the street and the dogs would be eating the bodies. So there was so much trauma. The second major event that followed precipitated some of the mental health issues we see in Liberia was the Ebola. Basically, Liberia is on the west coast of Africa and shares border with two other countries, Sierra Leone and Guinea. In this green dots, I try to illustrate how Ebola was very interesting. There is a tribe that are found in the three countries. They share contiguous border. They intermarry, they attend funeral. And Ebola started in Guinea and spread to these 3 countries. As a matter of fact, I come from this tribe. It's called the Kisi tribe. This is my own tribe. And there was so much death and devastation from this. Eventually, the disease made its way to the capital city, Monrovia. At the end of the day, several thousand persons got infected. The system got disrupted again. Some of these young teens that saw the Civil War were again exposed to trauma from death. There are some unique points I want to say here. In the midst of the Civil War, Liberia contributed towards almost 50% of all the deaths that happened. All the cases, we had the highest number of deaths. There was so much death in the country. There were predictions that over 1.5 million Liberians were going to die. Essentially, there were back-to-back trauma that exposed the teens and the young people. What I tend to show you, we call the epic curve. This is in days. There was a time we were reporting almost 50 to 100 cases per day. The trauma from the ambulances were just too numerous for us. So imagine having escaped Civil War, all of a sudden you come back. Now, so we show that there were 2 independent events that sort of interacted to lead to major trauma for most Liberians, as we'll see later. After the Ebola, the president asked me and a colleague of mine to help set up the US CDC counterpart. So we set up the system to help Liberia to be prepared. And so we set up this system to look at how we could prepare the country. This map was produced by Resolve to Save Life, that is headed by the former director of US CDC, Tom Frieden. Because of our investment in our work, Liberia became yellow, but it still means that Liberia is vulnerable to other infectious diseases. I want to show the impact of the Ebola on the country. The World Bank did this essentially. So our GDP reduced by 2.2 billion, as you can see from the map. Basically, we're on a level recovering our GDP after the Civil War, but Ebola took us all the way down and disrupted our GDP. The US government alone, to help us contain the outbreak in West Africa, spent around $2.4 billion to help us to survive the Ebola, as the predictions were that around 1.5 million Liberians were going to die. I mean, I was in the fight, and there was a time that I convinced myself that there was no way I was going to survive the Ebola. I was going to die. I think it was good for me that I convinced myself, because it made me to be very calm and calculative as I lead the response. So Ebola ended, but we still see emerging diseases. So that should have protected the face of these kids. There are many other diseases still face the country, like such as, this is monkeypox. Monkeypox technically had disappeared. We had eliminated monkeypox with the advent of smallpox, but we see a re-emerging Liberia. These kids, we found them in the counties with these very disfiguring diseases. So basically, the country still continues to face new threats, monkeypox, meningitis. These are all diseases of outbreak. The country is still prone. Now, you know, I spoke about health system resilience. After the Ebola, we wanted to develop a system that will be able to respond to future outbreak, and it's so that we don't repeat the same road where, because of an outbreak, the whole system collapsed. And so, if you all came together, we made a visit to Malaysia and many other countries to study that model, and we came back and we built this system, looking at all of the components of the health system to make it better so that the country will not be vulnerable to the next outbreak. So basically, the ability for a health system to detect and respond to a disease or an outbreak without disrupting economic and livelihood activities like we saw in Ebola is what we call resilient health system. This is a good illustration. So every time we have a major disease like COVID or Ebola, the whole health system goes through a shock. It disrupts the entire country. But if you build a good resilience system, the shock goes down, but you are able to recover quickly. And so that's some of the work we've been doing in Liberia, helping them to have a resilient health system. These are all, I will share this slide if you want to look at. But in order to have a system that is resilient, you must be able to finance the health. You should develop good leadership. You should be able to provide service to people. These are some of the things we've been doing over the years to help the country to get better. Maybe a true measure of that is maybe our performance in the COVID-19. We invested since 2014 to help to build this system that will be resilient, that will be able to withstand the challenges. Like I said to you, even after Ebola, we kept on facing new outbreaks. We had a meningitis outbreak in the southeast of the country. What was unique was that meningitis, there is what we call the meningitis belt in Africa. It starts from Senegal, it goes all the way around Ethiopia. But Liberia is just below the belt. I was coming from a meeting in the US. I had gotten down in Belgium, Brussels, when I got a message that there were 9 sudden deaths. People had gone to a funeral and 9 persons had died. Another 9 persons on a critical condition. We couldn't explain why were people dying at a funeral. And so we began to take samples. We sent for pathologists because we don't have a pathologist in the country, by the way. We took the specimens, sent them to the US CDC in Atlanta. And they said to us that we had a new strain of meningitis that had come from Niger through the gold mine and was responsible for the sudden death. At the end of the day, 13 persons died. So our system has gone through repeated testing, mild outbreak, but we did better than 2014. Some of the investment we did, the government did, was able to develop a good system. We trained group of people that had the ability, we had good laboratory system. I wouldn't want to. So this is the health system in Liberia. I will take my time to explain this to you. So before the Ebola, we only had a regular healthcare system. We have 1 tertiary hospital in the capital city. The country is broken down into 15 counties, and each of those counties have a hospital. And then they have the districts. These are health centers. Some of them have doctors, some do not have doctors, and we have clinics. So at the level when Ebola started, this was the only system we're relying on. We did not build the public health sector. And so Ebola came and ran over us. And we realized quickly that if you don't build the public health sector, when there is an outbreak or an epidemic or pandemic like COVID-19, the entire health system gets disrupted, the economic system gets disrupted. And so when the president asked us that we want you guys to help us set up Liberia's Center for Disease Control, we did that and we built the system. Between 2016 and 15 and 16, after we traveled to Norway, Malaysia, we came back. And then with some of my colleagues from the National Institute, the US National Institute of Health, we were able to build the National Public Health Institute of Liberia and set up surveillance system across the country. Now, what that means is that besides the regular health service system, we have teams in the field tracking diseases every single day. And we can analyze those diseases and see if they are reaching epidemic proportion. That has helped the country in multiple instances. I don't want to go into detail because of time, but I remember when we had our elections in 2017, and there was about inauguration. Then we got a call that said that people were dying in the northwestern part of the country. We triggered a response. My colleague from the World Health Organization and the US CDC asked me, we are about to have inauguration in 2 days' time. There will be dignitaries from the US and Europe. Should we cancel? I said to them, give me 24 hours. Eventually, we got medication prophylaxis. We flew them into the country. We were able to control the outbreak from the very part that Ebola came from. And so finally, we had inauguration. Basically, when you build a resilient health system by investing in public health, you are able to protect your regular health services. If you do not have the public health system that is built with trained manpower and good laboratory system, it affects and disrupts the service delivery. And we also saw that happening with COVID. Now, let's look at COVID. Liberia is one of 6 countries that has achieved 70% vaccine coverage, the COVID vaccine coverage. They've done a great job. When COVID started in 2019, I was the Director General of the Institute. And we started putting in measures, set up good laboratory system. We sent some of our laboratory technicians to the Institute Pasteur in Senegal. They came back from there, and my system was able to detect the first COVID-19 case. But what all Liberia has become an exemplary example of the result of investing in strong public health system, what we call the resiliency. If one word we remember is the word we call resilient health system. We say a resilient health system is able to detect and respond to a threat without disrupting normal function. So because of that investment, we're able, and so building upon that, Liberia has done very well so we have around 4 million persons in the country, 4.5. As you can see, the country has managed to vaccinate and achieve the 70% target. So the country has been making very steady progress. It's one of, I think, 4 or 5 countries in the entire continent of Africa that have achieved the 70% vaccine coverage in the population. The good thing also is that, as you would know, one of the people you want to protect whenever you have an outbreak are the healthcare workers. What we have shown over and again, once healthcare workers become infected, they become what we call super spreaders. They will infect their families and they will continue to treat other people. Not only that, but when healthcare workers begin to get infected, they will stay away from the treatment center and the hospitals, and the death rate will increase. But we've seen that we already have substantially immunized 99% of our healthcare workers. If you go back to see the trauma we got from Ebola, the investment we did, crisscrossing the continent, building the laboratory system, it has begun to pay off in the country. We also were able to immunize refugees that came to the country. So essentially, Liberia has shown itself to be able to build a resilient health system to respond to infectious disease threats. Let me go back and summarize the key concepts I'm trying to draft through. As a country, we have had 2 major traumatic events. The first was the Civil War that lasted for 14 years. I grew up as a high school graduate, just finishing high school. I went through the Civil War. It took me 11 years to finish to get my undergraduate degree, 11 years. In the US, in 9 years, I got 2 masters and 1 PhD. But in Liberia, because of the Civil War, 11 years to get a first degree. So you imagine the number of wasted years, the trauma we went through. The second trauma the country had to face was the trauma of Ebola, infectious disease. This was an invisible war. But at least we learned our lesson. The president wants us to call few of us to invest and build a better system, a resilient system. And that has been able to prove itself that it can stand under the yoke of the onslaught of an infectious disease, as you can see in the performance that we've done with the vaccines. So basically, before I transition to what we are all here to do, the mental health issue, is that keep in your mind that we have 2 traumatic events that has led to a lot of trauma in the country, but that we have learned our lesson. I think we are in a better position as a country to fight against infectious disease threats. That's the first thing. We've demonstrated that war in responding to multiple diseases on a different time. I remember there was an incident when a team was going to take drugs when we had an outbreak between Liberia, Sierra Leone, and Guinea. And they were in so much speed, the car somersaulted, and they called me and said, "Oh, Mosoka, there is an accident. The guy was taking the drugs." I think that was a mistake. I asked the guy, "Are the drugs protected?" Before I realized, no, this is human being. I just sent a guy to go to the front lines, and I'm not concerned. But later on, we got the drugs, and he was okay. But we had developed a system to respond very quickly and decisively on the outbreak. So we've done well with infectious disease. What I want to transition to now is that we had 2 major traumatic events that have created mental issues. How prepared are we for mental issues? How much have we invested into mental health? I think for the issue of war, I don't think Liberians want to go to war. We've tried our best because those of us that survived the war, nobody wants war. We know the pain of war. We went through infectious disease epidemic, and we try our best to build a system to prevent it. But what I don't think we've done well is that each of these major traumatic events created stressors that impacted all of our lives mentally. But have we done better in mental health? I can tell you, after the Ebola ended, almost for 3 years, every time I spoke about Ebola, I would be crying. Sometimes for no reason, every time I think about it, I would just share tears. I would cry. It lasted for long. I'll be doing interviews and I'll be crying. And I realized that I had seen so much death or trying to go to homes where families were decimated. And we never got any treatment after Ebola ended with the healthcare workers. Typical African were expected to mainly up. And I imagine when I begin to interview a lot of other people, one girl said she had to drink to go to bed because she was at the treatment unit and there were so many death and dying. So we went through 2 traumatic events, but I don't think we did enough investment in mental health. So we have a residual problem in Liberia, mental health. There are 2 key documents that we have used to look at mental health. One of them was the resilient health system. Mental health is mentioned, and one of them was the policy system. In each of these documents, we have emphasized the need to invest in mental health. But as we see along the way, mental health is one area that is still neglected in Liberia. We have great plans to invest in the education of our children that have severe emotional behavior disorder, children with learning difficulties. We have all of the beautiful policies, but I'll be honest with you, we have not been able to provide these services to the Liberians, the healthcare workers, and the teams that had to go through civil war. We've had policy that talk about one-stop shop, that we have system in place to help the young people, but that has not worked. Now, these are some statistics for you. It is estimated that of the 4.5 million people in Liberia, 10% of us have some common mental health disorder. There are depression, anxiety disorder, alcohol and substance misuse. This is common in Liberia. I've seen this where people are not able to manage their emotions. I've seen people fight, people will wound each other, people will take bottles and slash each other for very modern situation. Managing behavior has become very challenging in the country. And of that 10%, we are seeing 3% of the country is suffering from very severe mental issues. Schizophrenia, bipolar disorder. Imagine over 400,000 people suffering from mental health in the country. Epilepsy has happened to many persons I have known. The issue of addiction has become a phenomenon in the country. Everywhere you turn, people are not able to manage their emotions. It's like the least thing people. There was a day when I first arrived from the US in my country, and there was a misunderstanding at the university campus. I was driving and I just saw this group of young people in their 20s. They came outside and just took big stones and rocks and began to throw them at the university campus at the instructors. I was shocked. I like, are these students? The guy said, these are university students, and this happens every 2 months here. There are times the whole university gets shut down because people have not developed a mature way to manage the executive function to manage issue because of the kind of extreme mental disorder we have in the country. And what are the factors? I've just explained to you the 14-year civil war, the increasing sexual violence. There's so much poverty in the country. People are in poor housing. 85% of people are unemployed, low level of education. Youth do not have jobs. They cannot contribute to their families. So the daily pressure and stress. Then, of course, the major trauma we had. All of these are interacted to produce the kind of severe mental health issue we have in the country. There are studies have been conducted. It's high rate of depression, suicidal ideation, post-traumatic stress disorder, especially among the young soldiers. So just in case you don't know that, many of these kids were 5, 6, 7, 8 years old and recruited and given drugs. So there's high rate of these conditions you see among them. And some of the girls were recruited. They have a higher rate of suicide behavior. Some of these girls went through multiple rapes, sexual violence. And they cannot interact, like I explained to you, the situation at the university, because the fact is that they have never learned to cope with the stress. Imagine coming from this trauma and lose relative, and then there's no enabling environment to support you. And so mental health become an epidemic in Liberia. Like I said, with Ebola, there was, after the war, the trauma, we went through 2 years of war. There was psychological impact and trauma. As a matter of fact, really Ebola, because we use the ambulance a lot with the syringe, normally just hearing syringe used to trigger mental issues with people. So much to the point that we start using the sound of the ambulances. People lost their livelihood. There was fear, chronic illness. Of course, schools were shut down for 2 years. And more, as I was interviewing some of the survivors, I spoke to this lady who said to me, she got infected and went to the treatment unit. She lost her husband and all of her children. She said to me, since she came back from the treatment unit, it had been months. She has never been able to find sleep for more than an hour. She tells me that she slept for hours and she just stare into the air and do not sleep. I mean, I saw this guy one time. I was there with my breaking partner. I called the Ebola survivor to a meeting. It degenerated into a major crisis that she left the room and ran for her life. I was calmly seated and I spoke to them, and she said to me, Mosoka, these guys have lost all executive function. These guys don't know how to anticipate danger, don't know how to anticipate their action and find a healthy way to channel their anger. So that's the kind of situation we face. Of course, like I said to you, after the Ebola survivor came up, they went to stigma. There was massive stigma. Nobody wanted to come around them. They had serious mental health issues. It was sad. And I had to work with some of these guys. The ladies were undergoing multiple miscarriage. And then, of course, the only mechanism we know in Africa is during bereavement, is where the family comes together and cope. But we couldn't do that. We start people from gathering together. We took a step further by cremating the bodies. And in the African culture, cremation is so foreign. All of those just drove serious mental issues in the country. So we have a major crisis now on hand. We have mental issues because of economic conditions and poverty, because of the trauma of the war, but we have serious issues. We do not have drugs to manage mental health issues in the country. We have no wellness unit across the country. There is only one mental health hospital in the country, psychiatric hospital, and there is only one psychiatric in the entire country. The only psychiatric hospital can take only 80 patients at a time. It is dilapidated, needs to be repaired. There are no drugs. There are no specialists. There are very few primary healthcare people trained. Those children struggling with some of the coping issues with depression do not have means to be followed up. Families try to apply stigma on those children that suffer the depression that we created from our environment. We do not have in-service training to train teachers, so some of those kids go to school, they do not perform well, and we take them to be done. They send them home, so they drop from school, they go and become gangs, and they are drug addicts. We've not been able to even train community health workers to be able to diagnose at the community level. The police are not trained, and so when the kids begin to misbehave, they use excessive force on them. Most of our facilities across the country, only 7% of them have a trained mental health person. There is no access to mental health agency and medication. So we have this plan for young people. I know the goal of this project is to look at young people. There are great plans that have been set, but it's still far from reality. Man, nowadays, when the kids go to the only hospital, the hospital has those teens and kids along with the adults. The plan is to be able to get them in separate unit, but it's not possible. And because these kids are mates with the adults, they are abused at times. So they're planning to create a hospital that will separate the two of them. There's also a plan to make mental health services available to children, but they do not exist. There was a research that showed that if children have access to schools with good teachers, it was a way to reduce some of the mental health issues. But we do not have trained teachers to provide some of the early care services. Schools are very expensive for these kids to go to. And so basically they stay in the street and they become adults. They become criminals, they get into drugs, they increase in intimate sexual violence with the opposite sex. It's just a continual vicious cycle that is amplifying and probably started since we started the Civil War some years ago. So we have all of these great plans to provide psychological services to children and adolescents. Are these possibilities that the project can work on? I mean, we can provide the hospital, the clinic, but are there fundamental psychological services we can think about providing? I know you spoke about protecting, the last time when I spoke to Angie, we talked about foster care, using the parents or kinship care, because Africa is a close-connected kings type of society, kinship society. How do we work with families and provide education to know how to take care of these children and understand them? We need to invest into nations. It's still a big gap in the country. So if I was summarize for you, I hope I try to demonstrate in the last few slides that Liberia is a tiny country in West Africa, bordered by Sierra Leone and Guinea, around 4.5 million people. 85% of the people live below poverty. They are in crowded houses and live in swamps. Because of systematic bad governance, it led to civil war. The children got recruited into civil war. They got abused, and so there were serious mental health issues. We tried to recover from the civil war. In 10 years' time after the civil war, we went back into the Ebola crisis. Our health system was not resilient, and it created more and more trauma for the children and even those who were leading the response. At the end of the Ebola, we spent time to end the Ebola, but there were no investment in mental health because people forgot to know that those are also, even those who are the front lines. Then you talk about the children who lost their parents and their relatives. So we did well after the Ebola. We invested in a resilient health system, demonstrated by our performance with the Ebola and the outbreak. However, we have never invested in any the mental health disease that I've just shown you, all the mental health issues that have resulted from these young innocent children have been affected. Here I can tell you I survived the Civil War, I survived Ebola. Many nights I cried myself to bed. The trauma of seeing death. I don't know when I'm completely killed, but I try to survive and cope. But some of these things cannot cope. And I just show you that we don't have the agency and the structure in place to help these young people that are going through all of these, the result and the consequences of all of the trauma. The environment does not enable support for mental health. And so there's a serious issue. There's a serious silent epidemic in Liberia for teens that need a quick intervention. Because the rule is that very soon, mental health will contribute to 20% of all mortality and mobility in Liberia if nothing is done urgently. So this is an urgency, this is a call. Thank you very much. I hope I tried to convince you and I was a little bit clearer to you. Thank you very much.
Thank you, Dr. Fallah. That's exactly what we wanted. Excellent presentation. We do have, there's a couple questions. Do you have a minute to answer some questions?
Yeah, I have all the time. I'm here. Thank you, sir. Yeah.
Okay, thank you. If you can see them in the Q&A at the bottom, and I'll go ahead and read the first one that was already answered a little bit by Craig, but the question was, is the John F. Kennedy Hospital in Liberia the country's tertiary hospital?
Yes, thank you very much. That's the country tertiary hospital, John F. Kennedy in Liberia. And one of the ES brain, the mental hospital is one of the John F. Kennedy Medical Center. So the center consists of two institutions, three. One of them is the mental hospital that is away from JFK, but that's correct.
Okay, awesome. The next question. What efforts, initiatives are underway to build a system of care to respond to citizens' mental health needs, particularly the Zogos?
That's a very brilliant question. I don't know how to describe it. The worst thing, sometimes when I get emotional, there is no family in Liberia who does not have a Zogo. I'm saying there's no family that, as I speak to you, two of my nephews are Zogos.
Wow.
One of them lived with me, attempted to sell my car. You do, I send him to school, adapt, everything someone can do. That's the kind of thing we have. There's no family who does not have a nephew, a niece, or a child that is a Zogo in Liberia. But very few effort is being made. The talks have been a lot of political talk, but investment in really helping that generation that we are losing. There's very limited effort, concerted effort to target those Zogos, and we think that that's going to be the biggest security threat. People have to go home sometime by 6 p.m., 7 p.m. in Liberia because those guys, when the addiction starts, they commit violent crime to get the high. So it is a big problem, and limited efforts are being made to address that issue.
Wow. Thank you. The next question. There are 4 institutions that offer degrees in social work: AMEU, UL, Mother Patton, and UMU. They have all expressed interest in working with the public health sector, LPHI, to help develop a system of care. And this commentator said would love to connect Dr. Mosoka with the head of department for each social work program.
So it's not an issue of the social work program. How do we take all those talented pool and train them in a way to follow up, create a system? How do we pay them salary, minimum salaries, the social workers? Have a good organized system. That's the most important thing. Take those graduates, make them to realize that mental health is the biggest challenge to us, and invest some money in them. I just shared with Greg, the NIH is having a call for proposal for mental health among teens. I was telling Greg, can we write a proposal? Because we need to pay those social workers. They are graduates, they don't find job. How do we focus among those social workers, give them some basic salary, and give them some advanced training, like a cascaded training with someone from the US, how to follow up? So some of them are trained, but the issue of mental health as an area to have detailed training and follow on the youth. I don't see a system in the country. We need to bring those graduates, maybe write a proposal or something that can get funded for a long-term system that can be transitioned to the government.
That's a good idea. And we have one more question. Do we have any insight into why abuse occurs? I see that this is a prominent issue. Is there a way we can incorporate a solution to decrease the occurrence of abuse through our program?
Yes, like I said, going on the ground, having a situational awareness, that's one of the easiest. Exploring our kinship, the African setting with kinship. How do we train parents to either diagnose or prevent? What are those signs we can see that we can prevent? So some simple things that working with parents, creating awareness, finding models that have worked in the US that can be transferred easily, that is not too capital intensive. Having people on the ground, this will be some of the things that the students will do to really help us share experience, see what has happened in other countries successfully that can be adapted, and also advocacy, building strong advocacy to get the government, other key stakeholders to be involved. That mental health is a serious issue. There are a few Liberians like my friend Reverend Caleb Doma and others are doing it, but they are spread apart with limited resources. So maybe advocacy, sharing of experience, knowledge transfer, these will be some of the things that can really help.
That's great. Thank you so much. There's one more question here. What plans are in place to address the difficulties with supply chains for psychotropic medications?
And that's a very tough and hard question because supply chain and drugs, it goes across not only psychotropic drugs, but we still have a challenge with supply chain in our country. There are leakages, to be honest. Dishonesty and corruption get into the supply chain, even for essential drugs like malaria, is still a problem. So mental health that people don't take to be an immediate threat. It has to be, I know the Carter Center started some good work, but the Carter Center has slowed down because the Carter Center was able to train mental health clinicians. There has to be some kind of system, some kind of intervention that might let us start to build a supply chain system that eventually can be given to the government. But I think it's issue of priority between a malaria drug and a mental health drug, what people don't think is a major issue, between drug for pregnancy versus mental health. So it's going to be that level of advocacy and also trying to find source drugs that are cheaper, that can be affordable, that might have to be subsidized for the time being.
That's a good idea. Thank you. One more question here.
Actually, Joel, could I ask for questions from this
Yes.
room first? Okay. Are there any questions in here before we?
Yes. Some live questions here, Dr. Fallah, we're asking.
Oh, okay, go ahead.
Okay, perfect. One more question. You mentioned the U.S. and the United States pledged $520 million towards rebuilding Liberia. Do we know how this money has been used? Would it be a good idea to bring in U.S. officials or workers to help?
Like I said, the Carter Center did, I will have to admit, the Carter Center did a huge investment in mental health. I think they want to train around 350 mental health technicians and clinicians. So they took nurses, other healthcare, middle level healthcare workers, and trained them. But I think somewhere down the line, the project fizzled, and most of them went back to their professional job. So maybe if we can begin to think along the line of some of these social workers, because they were taking clinicians from the clinics and they were giving them additional training as mental health clinicians, but at the end of the day, most of them end up going back to their clinical care. So maybe we need to think of a new kind of program for mental health, some sort of way we can work with that, and then get a new maybe social worker that we can train. That has to be some kind of training. But so basically, the U.S. through funding from the Carter Center. But I see from many NIH call for proposal, which I want to share with Greg, there is big investment for low middle income country for mental health issues. So I'm more than happy to work with and UK, University of Kentucky, if we can go for one of those proposals. I'll just share with Greg. Or we look around, I saw many proposals coming up on mental health and managing environmental factors to reduce mental health in low middle income countries. There's something we can look at. The students want to come together with some of the faculty. We start looking at Liberia as a pilot project. And trust me, whatever you see in Liberia is happening in most African countries.
Thank you so much, Dr. Fallah. Thank you so much for joining us today and coming back to your alma mater. We're very proud of the work you've done. From COVID-19 to Ebola, and this presentation was great as well. I'm sure the students were thrilled to have it, and we just really appreciate you joining us from across the world.
Thank you so much. I'm always happy to be as a young guy escaping civil war from Liberia, coming to UK. I remember Jean, oh God, she used to be the head of the PhD program, and she had this very interesting story. She said this night she was trying to look at the applications, the folder. She said my folder was placed at the bottom of the pile at UK admissions. And the reasons were genuine. They said I had gone to school during the Civil War. I wouldn't make the PhD program. She said she went and picked up my folder. She said, Jean Harrison, actually she had a medical school. She said she pulled my folder and she read my life story. And in that life story, I said that I explained my long journey to the US. I told her I escaped the Civil War, went to Ghana in the middle of the night in the street, and took the GRE. And I said to her, I said in that statement, the determination I have taken me from war to Ghana will make me to succeed. And she took a risk. She admitted me. And when I started my first year at the University of Kentucky, I couldn't get a lab to accept me because most of the instructors were saying that I was a high risk. I didn't have the fundamental training. Dr. Subararu Bondada gave me the chance. I know I'm going to Harvard, I've done great things, but I can never forget UK. They really gave this African guy a chance. I'm always humbled to be here. Thank you so. Now I'm a little bit emotional. Thank you so much.
Of course, yes. Thank you so much. We really appreciate all you've done and this presentation as well.
Thank you so much. Bye for now.
Thank you. And we'll thank you all so much for joining. We'll conclude the keynote address at this time. We look forward to seeing everybody at the case competition tomorrow morning. And good luck on your cases to the students. So you all take care. Thank you.